Hi, I am Dr. P Sharat Kumar, one of the orthopedic consultant here. Today I have a lovely couple. This is Prem Raj and his better half, Sowjanya. So basically they had both had COVID almost 1.5 to 2 years back, and Prem Raj was admitted in the hospital. He was given a lot of medication, including steroids, and whereas Sowjanya, she was not admitted, but she was given medication including steroids. So after the acute COVID infection, she was all right. For after 9 months, she developed pain in her hips. Both the hips she had pain. Whereas in case of Prem, he had problems in all over the body, more or less, right from COVID. So I have seen Sowjanya after 9 months. After COVID, she developed pain in both the hips. For almost 3 months, she had pain. And when I saw her investigated, we did X-ray, MRI, and it showed avascular necrosis of both the hips. On one side, there was collapse. We did a replacement, right? On the right, it was collapse, whereas on the other side, it was grade 3. So she underwent right total hip replacement. We have done ceramic. It's uncemented on one side. On the other side, because the joint was preserved, we did decompression, what we call bone core decompression, and BMAC procedure. After that, she has recovered well. So whereas in Prem's case, he had problems in both the legs, both thigh, both hips for a very long time. For almost 1.5 years, he was suffering, and he was seen by many other colleagues, and we thought it's a post-COVID myalgia, arthralgia, like that. So when I saw him, we did X-ray and we have done MRI, and it showed extensive bone infarcts. In fact, both the tibia, both femurs, and both hips were affected. Because he was in a lot of pain, he could not sleep. Then we could not leave it like that. So I have done core decompression. I have done reaming of tibia, both femur, and both hips. And we also took bone marrow aspirate from the iliac. BMAC procedure also done. So in all, he had 8 procedures. Knowing that people can have complications if he had done everything on one day, because one can have fat embolism or pulmonary embolism. I have done first on one side, and after 3 days we have done the other side. So after the operation, he has done quite well. He is now almost asymptomatic. In fact, both are doing very well. You have, Prem, anything you want to add? Or your problems initially and how you are now?
Yes, after getting recovered from COVID, from the day 1 onwards, I could not able to bear my pain in my both knees, especially in the knees only. So even after the sleep, I could not able to walk even. So I can't able to stand even. So my legs are getting shivering. So that much of pain I was suffered with it. So after that, I was since we are from Vizag, so we inquired with a number of hospitals. We visited a number of hospitals. Everybody told that so they are focusing only on hip region. So since it is an avascular necrosis, so they are focusing on only hip. But in my case, I'm not feeling any pain in my hip region, but I could not able to bear pain at my knees. So one of my relatives told that referred Dr. Sharat Kumar, so that I came here. So you only given a hope for us. So why? Because there is an alternative procedure. No need to go for a replacement. Replacement is very tough task. So we no need to go for a replacement. So we have another procedure. So it created a hope for me. So after my treatment, so as you advised, so that exercise, regular activities, as it is, I was followed. So I am completely all right now. So I can able to do my own things alone. So I could not able to seek. I don't want to seek any other helps also. So I can able to do my own things on my own. So I am very happy about it. So my only thing is, if so I didn't neglect the issues. So when I getting a pain, immediately I approach. That is the main reason. Initially it was addressed. Otherwise it may go wrong even. So that is, I am very thankful to you, sir.
Sowjanya, how are you feeling now? You had COVID and then the hip pain, and you almost had for 3 months, isn't it? And how are you feeling after the replacement and the
After
bone
the
procedure?
replacement, actually, I am feeling very happy. Actually, now it is very comfortable to me. But actually, earlier I was very scared because when I got affected, when I came to know on Feb 15th, I came to know, I was like, okay, I'm getting so much of pain. I consulted so many doctors in Vizag. So they said, okay, only hip replacement is the only option. They didn't say about the BMAC and all. So actually, at that time, I came to know my left hip is also somewhat damage is happened. So I asked so many doctors that okay, so already my right leg they are saying that okay, you have to go for replacement. So what is the other option? Earlier stage only it got detected for my left hip. So is there any other process? But actually I don't know, but so many doctors told that there is no other option. So I was like, there is only one option that okay, when you got pain, come to us, we will do replacement for the other leg also. My age is like 33, so if I will go for replacement after 20 years again, I have to go for replacement. So it is not at all advisable, but even nobody is there to suggest properly. But I consulted n number of big hospitals only. So by God's grace, I came to know that I came here because of my brother. He only suggested that okay, here Jubilee Hills Apollo Hospital is there. They like you are treating for sports person especially. So he suggested that okay, once consult Sharat Kumar, once take his suggestion, then you can proceed. So after consulting you, seriously, I got a hope that okay, even my husband is in a very critical position. True. And even comparing to me, my husband is in critical position. I asked so many doctors to help him, but they didn't take any chance. I don't know. They simply we given these reports to Chennai also. They said entire leg they have to replace, like that they told us. So after that, after when I spoken with you, you said okay, we will try, once we will give a chance, then okay, first we will try, some option is there, if it will be good, then we will go for replacement, there is no other option. So we tried, now we are very happy, seriously we are very thankful to you. Until unless if we didn't approach you, maybe we went for in a worst case. Yeah. Simply by 4 legs it will go for replacement, seriously. So by God's grace we consult you, and I am very happy, especially in my husband's case. I am very very happy, seriously. So now we are not okay, little issues will be there. Why? Because still 7 months completed for him. So but comparing to COVID, he is okay. Now he is very good.
Thank you. So the take home message is early intervention. You see, it's early diagnosis and intervention is very very important. If we see a patient with these kind of we can preserve the joints. Otherwise, in late, even in her case, one side late presentation, we had to go for a replacement. In his case, it's a very unique case. We have not seen such cases. I was also trying to see the literature. Very 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 rare. It's and with God's grace, he has done very well. I think this will be the preferred way of doing the procedure, and it is a minimally invasive. I have reamed the reaming and BMAC procedure has helped him a lot.